Hi, clinical folks. So this video is going to walk you through the case of Carlos, which is an example of existential therapy. So Carlos is male, age 39, and he's Hispanic. He's originally from Argentina. In terms of his presenting problems, he has lymphoma. He's not sexually active because of his swollen lymph nodes. We'll get to that in a second. He has some fears of abandonment, maybe some sadism. He talks about fantasies of rape. He's unsocialized, maybe on the border of antisocial. Whenever he's disappointed that a woman won't go out with him, he's verbally and physically abusive to himself. And he is too weak to care for his own physical needs because of the lymphoma. And the only relationship he cared about was to his kids, which we'll get to in a minute why that's problematic. His mother died at childbirth. His dad died of the same cancer he has, so he's depressed because of that. And he isolates himself from all relationships. Question is he unsocialized or is he completely antisocial? So his twins, son and a daughter, they live with his ex-wife in South America. So he doesn't have that connection as much as he would like. He has a fixation on women. He's never had a male friend. He has to live near the hospital because of his cancer. No sex life. Women don't like his bald head, and the prostitutes think his lymphoma is a sign of AIDS. And he has unrealistic expectations about interactions with women. So he was in therapy for a few months. There was a tester period of 6 weeks. Is it worth pursuing? He did group and individual, and group is where some of this should go on. So they really started to challenge his beliefs, like, oh, well, if rape were legal, a rape should be legal. They asked him, what about your daughter? And that helped him. They did some dream analysis, deal with denial, helped with his unrealistic thoughts, differentiate between his core self and his other attributes, and insights. Everyone has a beating heart, and I am not my shoe. People always like that one. Client strengths. He made excellent use of therapy. He was willing to talk. When he found out he had cancer, he rearranged his priority. He became wiser. He became a generous and supporting father. And he wanted his daughter to have a loving relationship and a good family. And he eventually became helpful to the rest of the group. In terms of difficulty, chemo makes you really sick, so that obviously interfered with his ability to participate. He had trouble forming relationships within the group because of all of these attitudes he had. He took any mild criticism as a personal attack. Therapist trouble. Is treatment worth my time for someone who will pass away? And also his comments to the female therapist. He was socially isolated. Perspective on group talks different. He sexualized a lot of things. Wanted to ask out the group therapist. Raper, again, that's where the if rape were legal thing came in. And he had no regard for others within the group especially. Now, in terms of the results of treatment, he had his 2 insights, including I am not my shoe. He organized cancer self-help groups. He became a group leader for interpersonal skills at his church. And he got closer to his children. He told Yalom, who is the therapist here, you saved my life. So that's not something therapists hear all the time, but it's very, very touching when you do.